Good afternoon, everyone. Thank you so much for joining. We'll get started here in a few more minutes. I just want to give everybody enough time to join so nobody misses any information. For those that are here, if you wouldn't mind doing me a favor and just placing in the chat box that you're able to hear me okay, I'd greatly appreciate it. Thank you so much, everyone, and we'll get started here in just a few more minutes. All right, just going to give everybody just one more minute and then we'll go ahead and begin. Thank you so much for your patience. We'll get started here in one more minute. All right, let's go ahead and begin. Once again, good afternoon, everybody. I hope everybody's doing well, and thank you for joining. Also, thank you for having me. My name's Derek Cohen, and I'll be presenting our Medicare FAQs today. I'm actually an account coordinator here at Transitions Benefit Group. A couple things before we begin. This presentation will be recorded and a copy will be sent to you. It'll actually be sent to the email address that was used at the time of registration. So please feel free to please be on the lookout for that, and please feel free to share this with any coworkers who might have missed out on the presentation. And also, we're going to go over a lot of information. So, we're going to have a lot of great questions. So, what we'll do for you guys is after the presentation, we'll hold a question and answer session just to provide further clarity. So before we jump in, I just wanted to give a brief overview of our company here at Transitions Benefit Group. While I know that some of you are familiar with us, for those that aren't, we are a free Medicare resource being made available to you and your loved ones. Basically, let me slide over to the next slide right quick so you can see some of our services that we offer. Now, while of course we specialize in Medicare coordination, we're a white gloves. The way we operate, it's really similar to a financial planner. You can schedule an appointment with us by phone, email, or our easy to use online booking link. And an advisor will call you at that schedule. Include Medicare coordinate. Hi, if everyone can hear me okay, if you could please place that in the chat box. I apologize. There was some lost connection for a moment. All right, excellent. Looks like you guys can hear me okay. Let me go ahead and back up a little bit for those who couldn't hear for the last minute or so. So our offerings here at Transitions Benefit Group, we offer our services not just to you guys, but also to your loved ones. So if you have a spouse, parents, siblings, grandparents, aunts and uncles, or nieces and nephews, we will assist them as well. And this is at no cost. And it's for life as well. Even after you were to retire from your organization, we're here for you. And besides Medicare coordination, we also specialize in Social Security planning, dental and vision options, COBRA insurance alternatives for individuals and families, caregiver support, financial planning, and last but not least, educational support resources such as this very webinar. And additionally, your spouse or loved ones, when they give us a call, all they have to do is just state their name and their relationship to you, and then we'll help them the same way that we help you. So, again, I just wanted to take a moment to go over who we are for those that are unfamiliar with us. So, when it comes to Medicare, there's a lot of myths, there's a lot of questions. So we're going to go over those that are frequently asked the most. So first of all, let's talk about eligibility and enrollment for a Medigap plan, as these are key steps to securing your coverage. So, to be eligible for a Medigap plan, you must be enrolled in both Medicare Parts A and B. And Medigap plans only work with original Medicare. So you need to have both parts in place before you can apply for a supplement plan. Now, here's where the timing comes in. You have a 6-month open enrollment period to sign up for a Medigap plan. So this 6-month window, it begins the month you turn 65 and are enrolled in Medicare Part B. So this is an important period because during this time, you can apply for any Medigap plan without being worried about medical underwriting. And basically what that means is you can't be turned down or charged higher premiums because of your health history. So it's really the best time to get Medigap coverage at that time. Now, if you miss that 6-month open enrollment period, you can still apply for a Medigap plan, but you'll likely need to answer some health-related questions. And also, depending on your answers, your application could be denied, or you might have to pay higher premiums. But worse, some companies may even refuse to cover certain pre existing conditions, which could leave you with gaps in your coverage. And again, that's why we strongly recommend speaking with an advisor before enrolling in Medicare's Part A and B, because our advisors can help coordinate your enrollment, making sure you don't miss this critical window and help you avoid any of those gaps in coverage. So, understanding Medicare involves eligibility, coverage, enrollment, and cost. And common questions revolve around qualifications, coverage details, enrollment steps, expenses, Medicare Advantage, Medigap, changing plans, also coordinating insurance and appeals. And despite complexity, resources aid decisions, empowering confident navigation for personalized coverage. So, another thing is when it comes to Medicare, Medicare Part B is not free. You may pay premiums, deductibles, copays, and co-insurance out of pocket, just like with an insurance plan as well. No part of Medicare is completely 100% free. With Part A, you may have no premium, but there's still a deductible, copay, and co-insurance. And Medicare Advantage offers low or no cost premiums, but they include other costs. And then Part D coverage has a premium as well. So, just a couple of common misconceptions where that's concerned. Now, when it comes to understanding Medicare, it's good to go back to the basics and ask yourself, what exactly is Medicare? So, Medicare at its core, it's a federal health insurance program in the United States that provides coverage for individuals age 65 and older, as well as certain younger individuals with qualifying disabilities. Now, the program itself, it was established in 1965, and it's administered by the Centers for Medicare Services, known as CMS, and enrollment is through the Social Security Administration. So, as you approach Medicare eligibility and you enter the 7 month window around your birthday for initial enrollment, prepare for those solicitations. Now, what you're going to want to keep an eye out for with the mail is two critical pieces, one from the Centers for Medicare and Medicaid Services and the Social Security Administration. So, those are the critical communications you should retain. The rest, unfortunately, is most likely just solicitations. So, when it comes to who is eligible, Medicare eligible, this would be anyone 65 and older, anyone that is disabled and has been on disability for 24 months, and anyone with end stage renal disease or ALS. So, if you're working past age 65, you have more options available to you when it comes to your health insurance. At this point, you have a choice to remain on your employer group plan or enroll in Medicare. And that is what our advisors here help you decide. Because at the end of the day, we understand the importance of making the right choice for your individual circumstances. So, again, here at Transitions, we offer a very comprehensive approach. Our dedicated team of advisors, they'll go ahead and do a cost and benefit analysis with you where they look at the full range of options available for you, and they'll then assess what plans are offered in your area and consider the implications of either moving to Medicare or staying on your group plan. But overall, our objective is to provide you with the necessary information and assistance to make a well informed decision regarding your health. So I wanted to touch on Social Security for just a moment because the connection between Medicare and Social Security, it is very important because eligibility for Medicare is often tied to meeting the requirements for Social Security benefits, such as retirement benefits and disability benefits. And for individuals already receiving Social Security benefits prior to turning 65, enrollment into Medicare is automatic. And your Medicare card, it should arrive approximately 3 to 4 months before your 65th birthday. Now, what's important to know is that if an individual is not yet receiving Social Security benefits, there are a few options when it comes to enrolling in Medicare. You can reach out to the Social Security Administration at their 1-800 number to schedule an appointment, or you can sign up online. However, we would recommend starting this process at least 90 days prior to your birthday just to ensure a seamless transition and also avoid any issues with activating Medicare coverage. All right, so next up, we're going to go ahead and talk about the enrollment periods and the common questions regarding the enrollment periods. All right. So the signing up process, when it comes to the enrollment periods and signing up for Medicare, this tends to be the most confusing aspect, but I'm going to go ahead and do my best so we can simplify it for each other. So what are the enrollment periods? Can I change my Medicare coverage outside of the annual enrollment period? What is the Medicare open enrollment period? So first, we have your initial enrollment period. And that is the period when you can first sign up for Medicare. And that includes both Part A and Part B of Medicare. Now, it usually starts 3 months before your 65th birthday. It includes the month of your birthday and goes on for the 3 months that follow. So if you're turning 65 and qualify for Medicare, this is your important time to enroll. Now, this enrollment period is for making sure you can easily get comprehensive health care coverage through Medicare when you become eligible, allowing you to plan for your health care needs in a timely manner. So let me give you a little example of that initial enrollment period. Let's say you have John and he's turning 65 in September. So John can enroll in Medicare starting in June, which is 3 months before his birthday month. Then he has through December, 3 months after. So if John delays enrollment, he may face coverage gaps and potential late penalties. Next up is your special enrollment period, known as your SEP. So the special enrollment, it presents an opportunity for individuals to transition to Medicare beyond their initial enrollment period. Now, eligibility for this special enrollment period requires maintaining continuous creditable coverage from the moment of Medicare eligibility until the decision to switch to Medicare. So, upon the loss of creditable coverage, individuals have an 8 month window to enroll in Medicare Part B. So, in essence, this allows you to choose the precise date you transition to Medicare. And if you currently have creditable coverage, you have the flexibility to make this move at any point. And also, additionally, what's worth noting is that during your special enrollment period, if you happen to leave your group plan and you choose to go on to Cobra instead of Medicare, then you are only going to have 20% coverage since Cobra is considered non creditable. So let me give a little example. Let's say we have Sarah and she's working, covered by her employer's health plan. and she decides to retire at the age of 67. Her retirement is going to trigger a special enrollment period, allowing her to enroll in Medicare without facing late penalties. But Sarah should be aware of the time frame for enrollment during her special enrollment period. So next up was the general enrollment period. Now, this runs from January 1st to March 31st, and it's really designed for individuals who missed their initial enrollment period or didn't qualify for a special enrollment period. Now, these eligible individuals can enroll during this period to secure their Medicare coverage, with the coverage going in effect the following month. So during this enrollment period, you have the opportunity to make up for any missed opportunities to enroll and secure access to essential healthcare benefits. So let me give an example of that last period here. So let's say we have Lisa and she missed her initial enrollment period and she realizes this mistake in April. So she can enroll in Medicare during the general enrollment period from January to March of the following year, with coverage starting the following month. And due to this, Lisa should be aware of potential late penalties and also coverage gaps as well. So now let's talk about working past Medicare eligibility. So once you're working past Medicare eligibility, you have already gone in and out of your initial enrollment period. And as long as you have stayed on your creditable coverage, you will have that 8-month window where you can apply for Medicare after losing your coverage. Now, we don't want you to have any gaps in your coverage. So that's why it's very beneficial to work with an advisor to help you make that transition from a group plan to Medicare. All right, so now we're going to go over a few different things here. Um, we talked about also what does Medicare Part A and B cover, what is not covered by original Medicare, how does Medicare Advantage differ from original Medicare, what does Medicare Part D cover, and does Medicare cover dental, vision, and hearing services? So let's go ahead and jump into that. So first up, we have original Medicare, which is made up of parts A and B. Now, Medicare Part A, that's your hospital insurance, hospitalization, skilled nursing, and hospice. Now, Part A, it is premium free because it was earned throughout your work history. And to have earned Part A, you have to have worked an equivalent of 40 work quarters, which equates to 10 years. Now, let's say you haven't worked for 10 years. You can also earn from your spouse if you don't have that work history. Next up is Part B, and that includes your day-to-day doctor visits, outpatient care, lab services, also durable medical equipment as well. Now, Part B is premium based, and the starting premium for 2025 is actually $185 per month. So now that we have discussed original Medicare, let's talk about what is not covered by original Medicare. So prescription drugs. A and B generally do not cover prescription drugs. You take it home. You would need to enroll in a separate Part D prescription drug plan to get this coverage. And routine dental care, such as cleanings, fillings, extractions, dentures, and dental plates, is generally not covered either. Um, Medicare typically does not cover routine eye exams for eyeglasses or contact lenses. It also doesn't cover most eyeglasses or contact lenses. And then when it comes to hearing aids, Medicare generally doesn't cover hearing aids or exams for fitting them. And also, Medicare does not cover most long term care, such as assisted living facilities or nursing home care. So these are some of the most common exclusions. There can be others, but again, it's still best to go ahead and get with an advisor because they can help find alternatives to all these services that may be missing out on. So again, we're just a call away, and an advisor will be able to guide you through these circumstances as well. So let's talk about Medigap and Medicare Advantage. So the two of them differ from with Medicare Parts A and B. We have after that Medicare Advantage, which is known as Medicare Part C as well. And these are plans that generally have lower premiums but have copays. They may be restricted to a network and they may need referrals for specialists. They may include extra benefits such as the vision, hearing, dental, and fitness as well. And then we have Medigap, which is also your Medicare supplemental plans. Those have higher premiums but no copays. You have freedom to choose any doctor. There's no referrals necessary. And it's really covered anywhere in the United States. The only thing is that some routine services not covered might be vision, hearing, and dental as well. But when it comes to the two, it's great to check with an advisor where this is concerned as well to pick the best plan that is best for you, of course. So next up is Part D, and that's going to be your prescription drug plan. Now, Part D is a program really it's designed to help cover the cost of prescription drugs for individuals enrolled in Medicare. And here's a breakdown of key information about Part D. So, Part D covers both brand name and generic prescription medications. And there are standalone Part D plans as well as Medicare Advantage plans that include prescription drug coverage. And each plan has its own list of covered drugs known as a formulary. And also, each plan has its own list of premiums, deductibles, and copayments. Now, I mentioned formularies. So, Part D plans, they have formularies listing covered drugs and their tiers based on cost. Now, generic drugs are usually in lower tiers with lower copayments, while brand name drugs are in higher tiers with higher copayments. And in addition to the monthly premium, you may have a yearly deductible and coinsurance or copayments for medications. And lower income individuals may qualify for extra help to reduce that Part D costs. All right. So we mentioned dental, vision, and hearing. Now, this is a topic we get asked about quite frequently. So if you go with the Medicare Advantage plan, which is your Part C, some of these include dental, vision, and hearing benefits, but it's important to note that costs, network considerations, and coverage limitations vary among plans. So it's crucial to carefully review these Advantage plan details before enrollment just to ensure alignment with individual healthcare needs. Now, with original Medicare Parts A and B, it does not cover any of these benefits unless it's considered medically necessary. So typically, dental through vision is not considered medically necessary. So original Medicare doesn't cover eye exams, eyeglasses, or other vision related services. However, Medicare Part B may cover some things for vision, and this would include preventive or diagnostic eye exams, such as glaucoma tests, yearly eye exams to test for diabetic retinopathy, also eye tests for macular degeneration, cataract surgery, and prescription lenses or eyeglasses in certain situations. But when you're talking about just your day-to-day vision test, these would not be covered. However, you can get a standalone product for this. And here at Transitions Benefit Group, our advisors can guide you through these additional benefits and assist you with finding standalone plans that really suit your needs. So, when it comes to the questions regarding costs, such as how much does Medicare cost, what are the premiums for Medicare Parts A and B? Um, so, if you have a higher income, you're going to pay an additional premium or surcharge for your Medicare Part B and Part D prescription drug plan. So, this amount is known as IRMA, or Income Related Monthly Adjustment Amount. Now, how IRMA is calculated is going to be based upon your taxes from 2 years prior. So, if you enroll in Medicare in 2025, you're going to look back at your taxes from 2023 to see what your Medicare Part B and Part D surcharges are. So, that is going to be based upon your adjusted gross income. And we can help you figure out what you're going to pay and what your Part B and D surcharges are going to be, or if you're going to pay that base rate of $185 a month that we mentioned earlier. All right, so here's a little chart about IRMA. So, like I said, IRMA stands for Income Related Monthly Adjustment Amounts. And these charges, while based on your adjusted gross income, known as your MAGI, the Social Security Administration typically uses the tax return from 2 years ago. And on this slide, you can see what your Part B and D surcharges would be. And if you look at the chart, you can see what category you fall in based on income. And as I mentioned, your IRMA, remember, it's based on the amount you made 2 years ago. So what you filed in 2023, that would affect what you'd pay in present day. And now that we discussed IRMA fees, I want you to consider a scenario where you and your spouse are entering retirement, resulting in a reduction of current income. Now, in this situation, our advisors here at Transitions can guide you through the process of filing an IRMA appeal. So, what this is this form is going to look at your current financial situation and can potentially lower the amount you pay for your Part B and Part D monthly premiums. So again, please speak with your advisor so they can assist you if this situation does indeed apply to you. So, as far as other frequently asked questions, does Medicare cover medical services received outside of the United States? Original Medicare typically does not cover medical services outside, except in limited situations such as emergencies. Can I have other insurance? You can have other insurance in addition to Medicare, such as employer sponsored coverage, Medicaid, or Medigap policies. Another one is, will I lose my current health insurance coverage if I enroll in Medicare? So, enrollment into Medicare generally does not affect your current health insurance coverage, but it's essential to understand how your other coverage works with Medicare. And how do I appeal a decision made by Medicare? So, if you disagree with the decision made by Medicare, you have the right to appeal the decision through the Medicare appeals process. And lastly, are there resources available to help me understand my Medicare options? So, there are various resources available to help you understand your Medicare options, including Medicare.gov, State Health Insurance Assistance Program, and also you have the team here at Transitions Benefit Group, and we're just a call or a click away. So before we get into our question and answer session, I just want to thank each and every one of you for joining today. I hope I was able to provide a lot of valuable information. I know we covered a lot. So please feel free, if you have any questions, please feel free to ask away in the chat box. I have Leslie here also from our team at Transitions, who's going to be more than happy to help answer some questions. So please ask away.
Hi, everyone. My name is Leslie. Thank you so much for having us today. We are so excited to be presenting you guys all of this great information. So I see that we do have one question. So if you delay signing up for Part B due to other insurance coverage, will you be penalized when you do sign up and you sign up for a supplement? So great question. So as long as you have creditable coverage through your insurance provider, whether that's your employer insurance or any other insurance that you have, as long as you have that creditable coverage, you are able to delay Medicare enrollment until you are ready to move to Medicare. So what that means is, let's say that you don't want to sign up at the age of 65. Let's say that you want to wait until you retire at 69. When you go to retire, what you'll do is you will get a form called a CMS L654 form, and that's also known as a request for employment information. And what you'll do is you'll take that to your HR department, and your HR department will fill out some information on that form for you, and then you will fill out the other portion. Once that form is completed, you'll take that to the Social Security Administration and you'll submit that to turn on your Part B. And what that form does is it provides evidence that you've had creditable coverage, and that will allow you to enroll into Medicare Part B without any penalties. So at that point, once you submit that form, you get your Part B turned on. At that point, you have an enrollment window of 6 months to be able to enroll into a Medicare supplement of your choice. After those 6 months, after those 6 months, you would have to undergo medical underwriting for a Medicare supplement. So please keep that in mind. Now, if you want to go with a Medicare Advantage plan, you would have 63 days to be able to enroll into a Medicare Advantage plan. Same with the prescription drug plan. You would also have 63 days from the point where you turned your Part B on. So those are some crucial deadlines. But as far as delaying coverage, if you have that creditable coverage, you're able to delay it until you're ready to make the switch or you're ready to retire. You just fill out that form and you take it to your HR department. And that form is what allows you to make the transition without penalties. So that form gives you a special enrollment window. Great question. It was suggested to sign up for Part A, even if you have company insurance. Is that a good idea? So this is a question we get asked a lot. So with your Part A is premium free. So that means that there is no monthly premium if you have acquired the 40 work quarters or 10 years of work history. So if you have that work history, you've essentially paid into the system and you get that Part A for free. But you want to keep in mind that if you have an HSA and you contribute to an HSA, you would not want to turn any parts of Medicare on Sorry about that. It looks like our coverage went out. Can everybody hear us okay now? Perfect. Thank you guys for confirming. So sorry about that. So let me restart with the question. And so it was suggested to sign up for Part A at 65, even if you have company insurance. Is that a good idea? So this is a question we get asked a lot. So with your Part A, like I was mentioning, in order to get that Part A for free, you have to have worked 10 years, which is essentially 40 work quarters. So you have to have that required work history, or you have to be able to earn it from your spouse if your spouse has the work history. Now, with your Part A, since there's no monthly premium, you are able to sign up for Part A. Since you're not going to have to pay for it each month, then you can just stay on your company insurance and turn your Part A on and use that as a supplement. But one thing we want you to keep in mind is that if you contribute to an HSA and you like contributing to an HSA, you would not want to turn any parts of Medicare on. Because once you turn any parts of Medicare on, you are no longer going to be able to contribute to that HSA. So if you have an HSA, we would not recommend turning any parts of Medicare on. Typically, we would recommend to stop contributing to an HSA 6 months prior to signing up for Medicare. That way you can ensure that you aren't making excess contributions. But like I mentioned, if you have an HSA and you want to keep contributing, don't turn any parts of Medicare on. Now, if you don't have an HSA, then you are more than welcome to sign up for that Part A. If we use the service, will we be charged a fee for helping us sign up for Medicare? So that's another great question. So here at Transitions, we are a free benefit for you to use. So you are able to reach us at 800-936-1405, or you can make an appointment online at www.transitionsrbg.com. And like I mentioned, we are a completely free resource. You will never incur any fees if you use our services. You get to work with your dedicated advisor for life. And the great thing about working with us is that we provide unbiased guidance. So that means that you are able to get all the facts, all the information, and all the guidance that you need. And at the end of the day, we just want to help you make that well-informed decision. And I also want to point out that we are also able to assist not only you, but also your family members, your loved ones, just anyone that needs that guidance and assistance. If I decide not to start Part A because I have employer insurance and do not want to lose my HSA benefits, do I need to notify Medicare prior to turning 65? So great question. So if you are on your employer insurance, you don't want to stop contributing to that HSA, you do not have to do anything. But one thing that I want to mention is that if you draw your Social Security benefit low, so let's say you're first eligible at 62. If you start drawing that Social Security benefit at 62, 63, 64, 65, whatever age, that automatically enrolls you into Part A and B unless you opt out of your Part B. So that's just something for you to keep in mind. A lot of people aren't aware that when they sign up for Social Security, that they will automatically be enrolled in Medicare. So you just want to be cautious about that. But other than that, if you aren't enrolled to get that Social Security benefit yet, then you do not have to notify the Social Security Administration. You would just continue on your employer plan. You would keep contributing to that HSA. And then whenever you are ready to make that transition, then at that point, we would certainly recommend getting with an advisor from our team, talking about your timelines, when you want to make that transition. And at that point, they can help you with all the paperwork, and they will let you know where to submit that paperwork and what your deadlines look like. So that's another great question. If I decide not to start Medicare, we just went over that one. If you keep on working after full retirement age and start collecting Social Security, will the Social Security income stay the same, or is there any way to get the increase that comes with working until 70? Not really a Medicare question. So that is a great question. So when it comes to Social Security, the great thing about working with transitions is that we have a dedicated Social Security advisor here with us. So she's able to go through all the different scenarios with you. There are actually so many ways to strategize on how to optimize that benefit. So it's really great to make a consultation with her, and she can go through all of those different scenarios with you. But in terms of your question, if you work after your full retirement age and you decide to start collecting Social Security, you can still increase your benefits, but not in the same way as it would increase if you were to wait until you turn 70. So if you claim at your full retirement age, let's say that's 66 or 67, depending on your birth year, your benefit is considered full. Now, if you were to keep working, your Social Security will review your earnings each year. So that's called an earnings limit. So they'll see if your new income increases, or if it bumps one of your 35 highest earning years. So that's one of the ways that they calculate your benefit. And if it does, what happens is they'll automatically recalculate your benefit and they'll give you a slight increase, usually the following year. But one thing that I want to mention is that you don't get delayed retirement credits. So that's one thing you want to keep in mind. So essentially, if you start collecting at your full retirement age and you keep working, you won't get the full 8% annual increase. Great question. So another question, let's see. How are you paid? So that's another great question. So transitions, we partner with your employer. So your employer includes us in their benefits to be able to provide us as a free benefit to you. So they pay for our services, and that allows us to provide our services to you and your loved ones and your friends at no cost. If I retire at 62 and start drawing Social Security, I don't need to enroll in Medicare at 65. So great question, Jeannie. So when you retire at 62, that's when you're first eligible to start drawing your Social Security. So that's correct. So when you enroll for your Social Security, that will automatically turn your Part A and Part B on, unless you opt out of your Part B. Now, once you turn your Part A and Part B on, at that point, your Part A and Part B will only cover you at 80%. So that means that only 80% of your medical benefits will be covered. So you would need to either decide if you want to go with a Medicare supplement or if you want to go with a Medicare Advantage plan at that point to complete your coverage. So that would cover you at 100% at that point with one of those two options. And if you reach out to us and you work with one of our dedicated advisors, they can help you decide which route you want to go with, because it is very complex, and they'll take a look at your personal situation. They'll take a look at what kind of benefits you're looking for, what kind of coverage you're looking for, what carrier you want to go with, what kind of plan you like. And that way, when you do turn 65, you're able to decide if you should go Medicare supplement, Medicare Advantage plan, and then they can help you decide what you should do about your prescription drugs as well, because that's another thing you're going to want to think about. But in terms of your question, if you start drawing Social Security, yes, that will trigger your Part A and B to start, unless you opt out of your Part B, and that will automatically turn on when you turn 65. And at that point, you would just need to decide Medicare supplement or Medicare Advantage plan and what you want to do about your prescription medications. All right, we've had a lot of great questions so far. Does anyone have any additional questions? All right, I see another question. So then you should opt out of your Part B. How? So in order to opt out of the Part B, when you go to apply for your Social Security, there's a section that asks if you would like to opt out of your Part B. So you would just select no on that form. And that way you are able to decline the Part B. And that means that it's not going to turn on when you turn 65 if you don't want it to turn on. So that would be how you would opt out. To follow up on my question, then I would be able to get Medicare at 62 just at 80% coverage. So in terms of Medicare, there are a couple of ways to become eligible. So the first way is to be 65. So you would have to be 65 to get your Medicare coverage. The second way is you would have to be on disability for 24 months. And then the third way is you would have to have end-stage renal disease or a condition known as ALS. So those are the only three factors that would qualify you for Medicare. So you would have to wait until you're 65 to get Medicare coverage. But what I was mentioning was that when you draw your Social Security, when you apply to get that benefit, it will automatically trigger your Part A and B to turn on, but that Part A and B won't turn on until you turn 65. So while you're getting your Social Security benefit, you don't have Medicare at 62. It would just turn on when you turn 65. Does that make a little bit more sense? Perfect. I'm so glad I was able to clear that up. You guys have had such great questions. So thank you guys so much for all of these fantastic questions. Do we have any more questions so far? Any more questions so far? All right, we're not seeing any more questions right now in the chat, but we are going to give you just another minute to type in any questions if you have any. In the meantime, we just want to point out this is a free benefit for you, your family members, your friends, and it is a lifelong benefit as well. So you're able to use this while you're employed. You're able to use this if you retire. You're able to use this at any point. So I will always recommend just notating our information. So our website is www.transitionsrbg.com, and I will type that in the chat for everybody to have. And if you go to our website, we have a lot of great videos. We have a lot of informational resources and forms. And you're also able to schedule an appointment online as well. Or you can also reach out to us at 800-936-1405, and that is our direct line. So whenever you reach out to us, you will connect with our customer service representative, and you just let them know what kind of appointment you're looking for. If you're looking for a Medicare appointment, if you're looking for Social Security, if you're looking for an individual and family health appointment, if you're looking for dental and vision options, if you're looking for caregiver support. So we are able to help with all of those areas. And if you ever have any questions, just feel free to reach out and we would be more than happy to help. So I don't see any more questions in the chat, but we went over so much information today, you probably don't even know where to start. So I completely understand. So just make sure you get our information down. And if you do come across any questions or if you need any assistance, please don't hesitate to reach out to us. That's exactly why you have our team here at Transitions. We would be so happy to hear from you, and we would love to be able to assist you with your Medicare journey. So thank you all so much, and we really look forward to hearing from you soon.
Have a good day, everyone. Thank you so much.